Today we will be speaking with Dr. Jillian Roberts. Dr. Jillian Roberts is a registered psychologist. She completed her Master's of Education in Counseling at the University of Toronto and her Doctor of Philosophy at the University of Calgary. Dr. Roberts is a research professor at the University of Victoria. She has written multiple award-winning children's books. In 2020, she was awarded the University of Toronto's Leader and Legends Alumni Award for Distinguished Service, and most recently in 2021, she was recognized as an honorary citizen of the City of Victoria, British Columbia, Canada. And Dr. Roberts, you have been through this pandemic just like all of us, but you have a different perspective than many of us because you have actually been working with children and families long before the pandemic. And now you are seeing the effects of this pandemic in families, in children. Could you tell us a little bit about maybe your day-to-day, how the pandemic and how it has maybe impacted families from your perspective?
Absolutely. Families are under incredible strain. Many families, especially in Victoria, we are a tourism destination. And when the lockdowns have occurred, people haven't been able to travel. So we've had, our stores and economy, hotel industries that basically rely on tourism dollars have been hit hard. And what that means is that's moms and dads of kids, stores closing down, restaurants closing down. These are the families of the children that I see. I've also, it's quite expensive to live on the West Coast. And so I see many multi-generational families, like many different people living in a single home. And that means that there's elderly grandparents often. And some families, there's been a tremendous amount of stress and sometimes conflict because, when there's different levels of lockdown and when, schools have given families a choice, you can come back or not come back, the lack of definitive guidelines at times where it's about like basically do what you feel comfortable with. For some families, that makes it very difficult because you could have different opinions within a home. And, for some children who really, really badly want to go and be with their friends, that means that they're not allowed to go upstairs and visit their grandparents. So, so there's been like tremendous different levels of concern. I've got a whole bunch of very, very anxious children who are worried about getting COVID themselves. That have put on so much hand sanitizer that their hands are raw, washing their hands so much, their hands are raw, being so nervous, and going to school with a sense of trepidation or fear. And especially when we have had outbreaks at schools, there's been like a ripple effect of fear around that particular classroom or any of the extracurricular activities that those children play. And then there's been deaths. I've had children who have lost grandparents. There have been a couple of younger deaths in British Columbia, and so people my age who had children who've passed on. So it's been a very complicated and difficult extended period of time. The other thing I've noticed with children is there's been tremendous school disruption.
Yes.
And that hasn't necessarily been terrible for like grade 7 or 8. But when you're in grade 1 or 2 and you're just learning how to read, it's tremendously disruptive to have been taken out of that reading program or taken out of that therapy that child was in, that was required, like occupational therapy or speech language pathology or whatever therapy that is designed to have an early intervention, and then children just have their therapy stop, which has a ripple effect for the development. So tremendously complicated. So that's what's going on in the lives of the families that I'm seeing. For us on the thin edge of the knife, like those of us that are working frontline mental health, much longer days, much longer days. I was able to see my sister-in-law who works in healthcare, and so she's been very, very careful about not coming over when there's been outbreaks. Even though we're all vaccinated, we're still quite careful when there's new variants. And she came over last night, and we Zoomed with my daughters who are on the East Coast. And so I brought my computer out and my Zoom, and she looks down at my inbox little icon on my bottom of my computer, and she said 1,023 emails. Like I had 1,000 emails that I hadn't yet figured. I'm pretty good at getting through them, but so much bigger demand, and much longer wait times, and much longer days.
And so would you say then that accessibility to mental health services has become an even greater issue now than before?
Without question. I mean, that it is, when people would talk about, emergency room, people got worried about our Canadian healthcare system when they'd go to emerge and wait for 7-8 hours.
Yes.
Right. If you haven't yet required mental health service, I'm so happy that you haven't had to do that. But if you are trying for the first time, and you have no pre-existing kind of system in place, right? And you're for the very first time trying to get your team together, it is months and months and months of a wait.
Yeah.
And that's even for private. That's even for private. It's not just trying to get somebody through the public healthcare. And there's some new practitioners, but for family doctors or pediatricians who want to work with a certain private healthcare agency, they know what they're going to get if they work with a certain team. It's kind of like risky, and you have no idea what you're going to get working with people you haven't worked with before.
Right.
You're waiting, and so I've been trying to, in our office, be as creative as possible, working, to be honest, with many interns and doctoral students from different universities. I'm a professor at UVic, but we are welcoming interns from, universities from across the country. But we're working with these interns, doctoral students, to work together, trying to meet the demand, trying to basically amplify and create additional ways of getting care. Might not be the same that it was a year ago or 3 years ago, but it's still good care, but it's different care. So trying to come up with creative ways. And I know in our industry partners are also trying really hard to come up with creative ways of meeting the needs of our community.
And one of the initiatives that you've become involved in is something called Cognito. And how does Cognito address this? I would say this is a crisis at this point. How does Cognito maybe help to ease that, or what is the thinking behind this initiative?
Incredibly innovative way of partnering pharmacy with primary health care, like family doctors, with psychology. Cognito is a subscription-based service, so families can budget, exactly how much it's going to cost, which is $99 a month. But for that $99, you get a dedicated family doctor for mental health, and any prescription that you might need, paid for and FedEx to your door. And then you get 2 counseling appointments in the month from counselors we call care coaches, because, to be honest, they're interns.
Right.
Yeah, we're trying to work with people that have lots of education but aren't yet fully licensed, but need their hours to become licensed. So they are tightly supervised. We have programs that I've developed that they follow. So when they're working, it's a very tight CBT type of program that they work with people through. But we have found just incredible uptake, such an incredible response to Cognito, and we've only limited it to British Columbia. So it's been very, very exciting. Like for me, what's exciting is to be able to have a physician that I can talk to, because so much of the time, the children, families I see go to walk-in clinics, and it's like random doctors this time or next. And so it's really, really wonderful to have somebody I can speak to. Yeah.
And I think for that physician as well, just having your input, and then you both can have the same kind of treatment philosophy or treatment approach, having that unified front is probably really beneficial to treatment outcomes. What kind of issues are you seeing just kind of generally in your practice? Is there something that is there's just really high anxiety, insomnia? Are there any kind of themes, or are you just seeing a bit of everything?
The biggest challenge that we are seeing, the families that are coming to Cognito, are families that are experiencing a tremendous amount of anxiety, depression, and insomnia. But I would have to say anxiety is probably the number one concern. And when people feel highly anxious, they can do lots of things. And what we don't want people doing is self-medicating. Right. We don't want people engaging in risky behaviors to distract themselves from, their agony. We want people to be able to have proper treatment when they're experiencing a kind of mental suffering. What's interesting for us at Cognito, when you look at the analytics of when people come onto our website, it's in the middle of the night. So we're getting, by and large, the largest proportion of single kind of, visits to our website, like 3 a.m., so it makes me imagine, people tossing and turning and not being able to quiet their mind and suffering, or having woken up from a nightmare, and they're reaching out for help. That's the time when they're reaching out for help.
That's really interesting. I know that insomnia was a huge issue before the pandemic, and I'm sure the pandemic has just amplified that. And once you get into a cycle of insomnia, it can generate all kinds of different issues like anxiety, or they can kind of feed off of each other. Does Cognito serve children as well then, or is this adults?
We have brought the age down to upper adolescence.
Okay.
So originally we weren't going to see children, but we've brought it down to 17. So we are seeing upper adolescents, but not children yet. If families were wanting to access supports for children, they can actually reach out to Amira Health. Amira Health has another company that I'm involved with, has a variety of parenting courses that you can take. And there's also counseling services for children that you can access via Amira Health.
And do you find that families often reach out to you not when it's too late, but should people generally reach out earlier? What are some signs in children or adults that, it's time to seek some help? Because I feel like people generally wait until there's an absolute crisis or inability to cope with day-to-day life, and then they reach out. And if there's a bit of a wait, that can be really devastating sometimes.
Yeah. Well, let's just start with adults first, because we have some awareness. So when people are not well, they can respond in two ways. They can respond in a way that is internalizing, where the angst is directed inside of themselves. And often these are things that you can't really see easily. You can't see the extent of the suffering. People can also respond in an outward way, like being irritable, smashing something, getting into a fight. Like, you can also respond in an external way. We definitely want to find people before their suffering is on display,
right?
And they can get in trouble for their behaviors. And for an adult, when you don't feel like you're yourself anymore, when it feels like you're languishing, that the vitality has been sucked out of your life, when you are eating too much or too little, when you're sleeping too much or too little. The things that you used to enjoy, like sitting down and reading a book or watching a movie, they're just not fun anymore. Or it takes too much energy to even get through a show on television. Those are the signs that you should reach out. You don't want it to get to the point where you're missing several days of work, or that you're, turning to day drinking. You don't want it to get to the point where there's other things then that are going to maybe have an impact on your life. The one important thing for people is don't make any big decisions when you're feeling like this. Like, this is not the time to sell your house. This is not the time to break up from a long-term relationship. This is the time to just stabilize, because how you're feeling might feel very differently once you're well again. So you don't want to make any big decisions when you're not perhaps seeing things clearly. You're seeing everything through a lens of sadness or anxiety. For children, similar things, but some different things too. So again, like the not eating, the not sleeping, the not wanting to do anything, all of that. But we also look for regressive behaviors in children. So children who were completely dry at night, now wetting the bed again. Children picking at their hair, picking at their skin, behaving in odd ways, not wanting to go on play dates. Children who can't get through the night without crawling into bed with you. Clingy when they used to be, they were fine to be dropped off at school. Now they're clingy, crying for no reason, like just crying at the drop of a hat, like a little tiny bump that might have, been, shaken off easily now is a great big fit of tears. Being non-compliant, like children just not wanting to do whatever you're asking them to do. And it's almost like they have no energy. They've got just enough energy to put one foot in front of the other. The thought of having to do 3 hours of homework or, unstack the dishwasher or whatever is just like, it just, you have a pile of, a heap of a pile crying on the ground. It's really important for parents to know that when in this type of a situation, we're in an extraordinary situation. You are not spoiling your child if you do the dishwasher with them or for them that night, or if you let them snuggle in bed for a while, or it's these are not normal times. It's important that we understand that our children are suffering, that they're having a hard time, not that they're meaning to give us a hard time. We need to get at the root of what is wrong, rather in any way to be disciplining a child for not being well. We must always share our calm in these moments with children, not behave or react in an angry or disciplinary way that amplifies the child's chaos.
And that's a really important reminder, because we've been living in this for so long that it is becoming like this other normal, but it's a terrible normal.
Yeah.
It's high anxiety, and kids do respond even to our energy as parents. I'm a parent, so in certain ways that might not look like what our anxiety looks like, right? And so the fact that our kids need us is really crucial. And then just understanding, I mean, I've even seen with my own kids that there's certain responses to things, and it really surprises me that they actually are concerned about this pandemic. Often we think, oh, the kids are fine, look at, they're playing, they're doing this, and there's little comments or little things where they are anxious, they are absorbing all of this in their own way. And being able to interpret that as a parent, I think is, and even as grandparents, as caregivers, it's really crucial that we be sensitive to that.
One of the things that I tell parents is you have to show your child how to regulate emotion, right? Like it's not something that you're born with.
Yeah.
You know, a child learns how to regulate their emotion by being, you know, rocked back and forth. Like from the very beginning of age, we show a child how to regulate themselves. If you are dysregulated in your own self and you have a child who's having a meltdown and you're yelling at that child who's having a meltdown, what's actually happening is both of you are dysregulated, and the child isn't going to get better, isn't going to, you know, isn't going to stop melting down because you're yelling at them. So if you feel that you do that, do you know what? I give you permission right now to press the reset button. The fact that that was your go-to strategy in the past doesn't have to be your go-to strategy moving forward. If you want to make a promise to yourself that you're not going to lose it with your children, I'm going to give you a strategy here that's going to make it easier for you to keep it together in these really high stress times. And the strategy is called the 3 B's. The first B stands for be quiet, just stop talking. The second B stands for back away. So go get yourself a cup of tea, go get yourself a cup of coffee. You know, if you're a child, I tell the child, go get a sip of water from the water fountain, right? Just back away.
Yeah.
And while you're backing away, breathe deeply. And when we breathe deeply, it can't be shallow breaths. It has to be really long and slow breaths. And so I'm going to show you how to box breathe by using this screen. Sure. So you breathe up really slowly till there's nothing left in your lungs, like no more space. And then you hold. And then you exhale slowly till there's no air left. And then you hold. So that's box breathing. And so what you do is you look for any rectangular square in your line of vision, like a door or a window frame, right? Okay. And you do that. You force yourself to do it slowly, just like that. What's going to happen is it's going to help bring your cortisol levels down. It's going to help just settle your central nervous system so that you have the with-itness, the mental capacity to respond to a meltdown properly, right? Or and it could be a melting down child, it could be an argument with somebody at work, it could be whatever, but you know, if you want to keep it together so that you can be responsive to the situation, not reactive to the situation.
Yeah, that's really important. Thank you for walking us through that, because I know about box breathing, but I've never actually thought of envisioning a box. I just kind of, thought, of finding a box and just doing that, some kind of a square format in the environment that you're in. That's really, really good.
Yeah, people talk about taking deep, long breaths, but they don't really know what that means, because the breath has to be long and slow, and then there needs to be an element of holding the breath, right? So, and that's why a box is helpful, is because it reminds us to do that. If we're just taking, that's not what we're talking about when we talk about deep breaths.
Yeah. And does that work for children as well? Or are there different ways to calm children that does work?
Yeah. So with little ones, sometimes we'll say birthday candles, so take a deep breath in and blow out the birthday candle, hold, take a deep breath in. We'll try to come up with different visual analogies to basically communicate the same point. Another really fun one is pretend that you are drinking hot chocolate. And so first you smell the hot chocolate, and then you're enjoying the smell, holding the breath, and now you're blowing it to be cool, and you're holding, but just different ways of getting at the same concept of slow and then holding your breath. Yeah.
That's wonderful, Jillian. Thank you for that. One other thing I did want to touch on, because I think I saw something maybe you had posted or something along these lines, because we do have people watching who will be parents, but also caregivers.
Mm-hmm.
And one of the things that concerned me as a parent during the pandemic and still concerns me is the amount of screen time that
Mm-hmm.
we are allowing our children to be on. And with parents who might be anxious or emotional, sometimes it's just easier to put your kid on the screen. And it's really concerning as to what that is doing to our children. Can you just speak to that a little bit?
Yes. So, and I have to say, if what the child is doing online is of high quality,
Right.
right? And by high quality, I mean, like, and give you my favorites, Tiny Bop schools. So
Okay.
Tiny Bop is a company that came out of New York City in 2013, and they've got these wonderful engineering schools that are like interactive, and you can see under the water, and you can see like light being refracted through a prism, and it's very child friendly and really fun.
Wow.
Like if you need half an hour to get
Yes.
dinner ready and your child is playing a high quality game like that,
Yeah.
I'm not as worried, as many people are worried, right?
Mm-hmm.
What I don't want is completely unsupervised going on YouTube consuming garbage
Mm-hmm.
for 8 hours.
Mm-hmm.
For me, that is just a complete waste of time. If a parent you know the children watching a Disney movie so that they can put a towel over their face and get themselves back together,
Yeah.
I'm not as worried about using technology thoughtfully
Yes.
and carefully. So I think of technology as, is there a social connection? Like, is during COVID, when everything was locked down, some kids were only talking with other kids, online.
Mm-hmm.
Is it educational? Is there some element of like pure fun or delight, but not just streaming endless garbage? We know that children, we don't want more than 2 hours a day, and I've got some families that have limited to half an hour a day.
Yeah.
That's fine. But, I don't think it's necessary. Like if it was like half an hour while you're making dinner, and then you have dinner, and then the family watches Gilmore Girls, now you're at like an hour and a half or whatever. Like, I don't see that as being a problem. It's just, you want the screen time to be thoughtful, not just like without boundaries.
Right.
You want it to be thoughtful, and you want it to be high quality, and you want the amount to fit, what you're comfortable with. But you do also want to give yourself like a little bit of leeway. Like, if you're driving up to Comox from Victoria to go visit, family who are sick,
Yeah.
it's much better for that child to be watching 2 Disney movies back to back than just sitting there squirming in the back of a car for 4 hours. Like, so, do feel like you can use the technology to make your moment calm. Calm is better than arguing with each other.
Yeah.
But I say that, and I don't want people to go crazy and have no boundaries.
Mm-hmm.
It does have to be thoughtful. Like, you've made a plan that day, it's going to be this much, and this is what you're going to do online. And, and then when that time is finished, you stop, but, and you also want to make sure that there's lots of other wonderful things going on in your child's life, that you're going for walks, that you're eating as a family, that, there's time spent jumping on trampolines and reading books and throwing balls around. Like it's just, the technology is just one little thing that can be a lovely carrot. You get your homework done, you can do Tiny Bop schools. It can be done in a very strategic way to
Mm-hmm.
make it easier for the parent to get through the day.
And the things that you mentioned about going out with your child and going for a walk or throwing a ball around, I mean, those are important even for the mental health of the parent.
Yes.
Right.
Mm-hmm.
So when we do those things, we're helping ourselves and we're helping our children. And that's something that I think can kind of fall off right now. We're in the fall and winter. There's been a lot of rain.
Yeah.
Right.
Yeah.
But those things are still possible,
There's been a lot of research done on the like ecotherapy.
Yeah.
So the benefit for people of getting into forests, getting onto beaches, getting into farms, you know, getting your hands in dirt. There's a lot of benefit to connect to our community. And if you go up north and you look at how we work with our Indigenous populations up north, getting onto the land is a critical element of any mental health care plan. But we need to take care of our earth. We need to care about our earth, love our earth, see what our earth and what our nature has given us, and protect it and covet it and treasure it. I think when you have a relationship with the land, you know, it just makes us all feel more compelled to take good care of the land around us.
Yeah, and you wrote a book on that. You had mentioned to me. Can you tell us a bit about? It's a nature walk book or something like that?
It's our first talk about environmental stewardship.
Okay.
And the foreword was done by Bob McDonald of Quirks and Quarks. And it's a question and answer book about climate change. But what is very exciting about the book is the book finishes on innovation. This idea that yes, climate change is a problem, but there are all these amazing minds, these amazing people working really hard around the world, around the globe, to come up with solutions, carbon trapping solutions and electric vehicles and all sorts of things. And so the book ends with examples of innovation. The concept with all of the books is to make sure children have good, honest information, but then also to leave them feeling hopeful, you know, that there is something that they themselves can do to take care of the world around them.
And Jillian, you also mentioned that you had done some work recently with some university students. I know this is not published yet, but the impact that the pandemic has had on this group of people. Are you able to share any of the findings from
Sure. Yeah. So working with the University of Victoria, I'm grateful for funding from the Office of Research Services at the University of Victoria. Myself and a research team, we've looked at three main areas of how COVID has affected the mental health of our students. So we've looked at, our first study was just a very general look across different groups of students. So we were very purposeful to try to get some international, some domestic, some students who are part of the LGBTQ community, some students that were Indigenous, you know, trying just to get a sense of the different populations and how they were experiencing the pandemic. So that is we're just in the final steps of doing the final edits for it to be published in Sage. Now, next, we've been focusing on two of those subgroups that we were interested in. One is international students, because there's some very significant stressors on international students. One is that they can't often fly home because of travel bans and lockdowns. Other parts of the world have had a much higher mortality rate than Canada has. So many of these international students are suffering because they've lost very close members of their family and haven't been able to return for like funerals. But also international students can't work the same way, right? So you know, if they were expecting to be funded by a family member and that family member passes on, they have to come up with different ways of surviving financially. So there's different stresses for international students. And then in addition, our students with disabilities. So we have a large community of students with disabilities on campus. And we're interested in wondering what it's been like when services stop, where it's harder, you can't meet people in person, and you're trying to navigate a university system, and there's already something that is a barrier. You have additional barriers now. What does that look like, and what do you need? You know, what do you need to be able to still have a robust and positive university experience?
Wow, that sounds like some really, really important work. I would imagine that loneliness is a bit of a theme. You see that?
Yeah, loneliness is, loneliness is huge. Yeah, I've children like that I'll see, and I'll just ask them if they're lonely, and just even the question will bring tears for minutes,
Yeah.
Yeah.
Yeah. Wow.
It's a hard time. And even if individual people feel like I'm okay, my larder's full, I know my family's vaccinated, I'm okay. And I think a lot of people are in that place, like right now. Just because you're okay doesn't mean that the family of the child who sits in the row next to your child, that they're okay. There's still many, many, many people in this community who are not okay. And so, contribute to those Christmas hampers, contribute to those requests for support on Facebook. That if somebody in your network that you trust and believe is trying to do something for a neighbor or for a child or for a family, give as much as you can give to people that are trying very, very hard to help somebody.
Yeah, and that's really important. And just to kind of summarize here, what you're saying is that those who are okay really need to stand up and hold the hands of those who are not. And it's a time where we've been all kind of shuttered into our houses. I mean, we're out more now, but we're still living under the banner of this pandemic. And I think that our proclivity is to just kind of keep to ourselves, and we're safe and we're okay. But like you said, there are people who are not, there are children who are not. And it's really important just to do what you can as a community member, to reach out to those who are not, and those who are asking for help, because it takes a lot to ask for help. It's not someone's been through a lot if they're actually asking for help. Generally, people don't just ask with ease.
And if you don't know, call the local principal of your local school and ask, is there a family that my friends and I can create a hamper for?
That's great. That's great, Jillian. Thank you so much. Well, we will put up, Jillian is a very well-established author, and she's done a ton of work. I will put up the links to your books and any of your other work in the description of this video. But Jillian, just in summary here, we are still living, like I said, under the banner of this pandemic and new variants and anxiety. Do you have any advice to give to those of us who just are trying to navigate this? And how we deal with even family members who might not be coping with this very well right now?
Dig deep, look for the calm inside of yourself, look for the patience inside of yourself. Take care, make sure you're taking care of your physical and mental health needs the best that you can. Feel free to say no to things, don't feel like you have to go to every Christmas party, say, if there are parties, but say no to things that you feel you can't manage. Don't expect to reply to emails the same day they're sent. I don't think that's a requirement any longer. If you're Zooming, this is one that I do. Like if you're Zooming like long meetings, feel free to turn the video off, so you can sit back and close your eyes and listen, not necessarily feel like you have to be all made up for the camera. Give yourself a little bit of leeway, and permission to not be perfect, right now. And I would say try to help people around you to feel hopeful. If you've got children in the car, instead of talking about like Omicron and this is going to go on forever, and like watch what you say when little ones are around. Make sure that you're not passing your anxiety baton to them, that within earshot, you're not talking about your financial worries, or that you're talking about things that are hopeful. Try to share hope with each other.
That is a wonderful, wonderful message. Thank you, Dr. Roberts, so much for your time today. This has been a real treat. I know that many will really appreciate this. Thank you.
My pleasure. Thank you for having me on your program.
Yes, take care.